So diet is super important during pregnancy. We don't want them to have maternal overnutrition because the baby can get too big. And we can have maternal problems as well if we have excessive maternal weight gain. You guys, I encourage patients to eat an additional 300 kilocalories a day during the pregnancy. What is that the equivalent of? A chicken breast, a grilled chicken breast. And people think they're eating for two. Nope, sorry, no bueno. You're eating 300 extra kilocalories a day. And so you guys, we want everything to be balanced. We want them to have minerals and vitamins. We definitely want iron-rich food, which would be dark green leafy vegetables, organ meats, beans, anything high protein. Folate, most folic acid is added to your salt, is added to dietary products, but you also can get extra folate in your what? Prenatal vitamin. And in our prenatal vitamin, we're going to have iron as well. This is because of physiologic anemia. We're going to have sluggish bowels because of all the changes, and we're having iron. And so that makes you constipated. So we encourage them to have high fiber in their diet. Tell me some fibrous things that they could eat. Yes, fresh fruits and vegetables is number one. Okay, fresh fruits and vegetables really help us with fiber. Calcium, we want to make sure they get enough calcium because if not, it's going to take your mom's bones, mom's teeth, magnesium, sodium, potassium, and zinc. We always ask, are you eating any non-food sources? And they go, what does that mean? I'm like, do you eat anything that's not food? How about like cornstarch that you use, that comes in a box, cornstarch that you use for cooking? Oh yeah, I eat half a box of that a day. In some cultures, it's well accepted, it's called pica, and what happens is when your iron goes down, it triggers these cravings. When you become anemic, the first one is ice. So I had that when I was a kid. I was a little anemic and I would just chew ice all day long, okay? So it starts out with ice, but it can go to clay dirt. It can go to laundry starch, cornstarch, baking soda. So you guys, we don't want them to eat this because if they are anemic and they have this urge to eat it, right? So they eat it. So what are they not eating? Iron-rich substances. Now, you Harry Potter fans, what's a Bezoar?
It's the stone there. Bezoar is a stone taken from the goat of, I think it's goat.
Okay.
Stomach of the goat.
Yes, so it's in the stomach. And a Bezoar, so you guys, they can have a Bezoar. They can have an occlusion in their gut with all this stuff stops it up, and they can actually have a rupture. Gross. And sad, right, you guys? So, in order for them, so if they ask you, is it okay if I eat this Georgia dirt? I only want to eat a little bit of this Georgia clay. You say, no, but I understand your craving. Dudes, always normalize how they feel and give them the intervention. I understand how you feel because you're anemic and you're craving something to change that anemia. But unfortunately, that Georgia clay won't help us. That cornstarch won't help us. It can actually hurt you. It can stick in your stomach and cause your stomach to rupture. Your intestine to rupture. So we don't want you to eat that. We want you to eat other food sources. So what you can do is you can go get a cast iron skillet, get some iron nails, of course, that are not used, throw them in there, cook your collards, and you're going to get some more absorbable iron from that. Okay?
Really?
Yeah? More absorbable iron. Yes. Yeah? Yes. Okay? So is everybody good? We don't want them with this pica because it's only going to make the situation worse. Okay, now, with the weight, you guys, write down, Stephen. There are weight gain recommendations. Now, these are out from the IOM, from WHO, from ACOG. We all say the same thing. Underweight women, BMI less than 18.5. I saw on the next slide, so don't write it down. They should gain 28 to 40 pounds. Normal weight women, 25 to 30 pounds. Overweight women, 15 to 25 pounds. And obese women, 11 to 20 pounds. Women should not gain more than 3 to 5 pounds in their first trimester. Why is that, you guys? Look how little tiny this is, okay? We don't need to gain 1/3 of our weight in the first trimester. We do not. Additional calories should be balanced. So here is your guide that you're going to study for your test. So, underweight, BMI less than 18.5. I'm not going to make you memorize the BMI. I'm going to say underweight. Tammy, your patient who is underweight, reports to the clinic in her second trimester, and she has gained 3.2 pounds. What is your counseling? Yes, absolutely. So, we've got underweight, 3 to 5 pounds. If you notice, all of them are 3 to 5 pounds in the first trimester. So, you should gain 28 to 40, so I just went with the high numbers. So, there's 35. So, you split the difference in the second and third trimester. You guys see that? It is an updated PowerPoint. Because I wanted you to have this and you didn't have it before. It's on there. It's on the site. So you can just download this one chart. Yeah, just print it. Okay, so you see 3.5, 3.5, 3.5. Okay, because I felt like this would help you more than me just putting that and just talking. Normal weight, 5 pounds, then 15 and 15. Overweight, 5 pounds, 10 and 10. And then look at obese here, 5, 7.5, and 7.5. Okay, so now you're going to understand what to do with counseling for what? Iron deficiency anemia. What is a potentiator of iron? Citric acid. Where do you have citric acid? Oranges, which is citrus. So you tell them to, now I know this is a little bit brutal, you tell them to take their iron on an empty stomach with orange juice. It's going to potentiate and it's going to be the most absorbable they can get. Okay? And then of course increase iron in their diet. How about for overweight women? What are you going to have? And let's say you have a normal weight woman that's gained 28 pounds in the second trimester. What are you going to talk to her about? Dietary log, right you guys? Show me where that extra 300 calories is. Let's get a fitness pal. Let's put in everything you eat in here because we don't want this baby to be too big that it won't come out or it's going to injure you or injure the baby when it comes out. Okay? Everybody good with weight gain? Oh, I do want to show you this. Can you see those arrows? Okay, so you guys look at all these problems when you have too much weight gain. Early pregnancy, recurrent miscarriage, spina bifida, hydrocephaly, miscarriage, cleft lip and palate. Late pregnancy, diabetes, gestational hypertension, fetal death, preeclampsia, UTI, thromboembolism, and gallbladder disease. And then look at postpartum and peripartum and neonate. So this is the baby and the mom if you gain too much weight. Anesthesia complication, wound infection, early neonatal death, shoulder dystocia where the baby's shoulder gets hung in the pelvis. We have a severely injured baby. Macrosomia, the baby's too big. Childhood obesity, 3rd and 4th degree. 4th degree tear is through your anus. Through your anus. Cervical dystocia, your cervix doesn't dilate because the baby's too big. Vaginal birth failure, instrumental delivery with forceps, might have a C-section, postpartum PE, and hemorrhage. These are very big reasons not to gain too much weight during pregnancy and to be a normal weight when you are pregnant. And then low weight gain is poor nutrition, dehydration, cardiac abnormalities, gestational diabetes. That's not. I mean, you can have, if you have gestational diabetes, it can prevent you from gaining weight because the sugar is inside of the vasculature if you're not getting insulin that you need. Do you understand that? Severe depression, premature births, labor complications, difficulty nursing, postpartum depression, bone loss, and calcium loss. For the baby, very high-risk baby if you don't gain enough. Poor development due to decreased iron and fat stores, premature birth, low birth weight, and age, respiratory distress, feeding difficulties, cold stress, and poor glucose control. And these babies usually get a little trip to the NICU as well. Thank you.